Migraines are so much more than just a bad headache. They're these really complex neurological events that affect millions of people. For a long time, our treatments were kind of like using a hammer to fix a watch. But that's all changing. Today, we're going to unmask the real culprit behind the pain and explore the scientific breakthroughs that are leading to smarter, safer, and way more effective migraine therapies. All right, so what exactly changed? I mean, for decades, the drugs we had were, well, a blunt instrument, often coming with some pretty serious side effects. So, what was the big discovery that let us shift gears from that brute force approach to a much more precise, targeted attack? Let's find out. Okay, so to really get why these new treatments are such a big deal, we've got to get on the same page about what a migraine actually is. And trust me, it's way more than just about headache. The details here are super important. Unilateral means that pain is just hammering one side of your head. And pulsatile, oh yeah, that's that relentless, throbbing beat. The one that feels like your own pulse is trying to break out of your skull. And all that agony, it's coming from inflammation and the swelling of blood vessels deep inside your brain. You see, for the longest time, our main strategy for stopping a migraine in its tracks was, well, pretty aggressive. The whole idea was to just clamp down hard on those swollen blood vessels. But that brute force approach, it came with some serious collateral damage. So the two big players in older migraine therapy were these drugs called triptans and ergotamine. Now, ergotamine, wow, it could cause some truly horrific side effects. We're talking gangrene even, which is why triptans quickly became the go-to option. But here's the kicker. Both of them shared a really dangerous secret. They could trigger coronary artery spasms, literally squeezing the arteries that feed your heart. Yeah, the risk was so serious that medical guidelines flat out forbid using these drugs together. It was a huge red flag, right? It showed that while we were fighting the pain in the head, we were accidentally putting the patient's heart right in the crossfire. We just had to find a better way. So this major side effect forced researchers to step back and ask a really important question. Is there a way to stop the head pain without messing with blood vessels everywhere else, especially the heart? Was there a smarter target? Well, the answer turned out to be yes, and it changed everything. All right, let's really get into this because this is the moment. This is the turning point where the entire field of migraine treatment takes a massive leap forward. Scientists started thinking, what if the swelling blood vessels aren't the cause of the pain, but just another symptom? What if something else is pulling the strings? The new theory was pretty radical. Maybe the blood vessels were just a red herring, a distraction. The real problem, the true culprit, was a specific little molecule, a tiny peptide in the brain acting like a master switch, kicking off the whole painful domino effect. And here it is. Meet our culprit, CGRP, which stands for calcitonin gene-related peptide. What researchers figured out is that when CGRP gets released in the brain, it's like lighting a match. It ignites the fire of inflammation and triggers that blood vessel swelling. It's the very first domino to fall. And that led to a groundbreaking idea. If you can stop CGRP, maybe you can stop the migraine before it ever really gets going. So, with CGRP finally in the crosshairs as the main target, the race was on. A whole new era of smarter, more precise migraine treatments was about to begin. This incredible new understanding gave birth to 3 totally new classes of drugs, and each one fights CGRP in a slightly different way. We've got the ditans, these amazing lab-made proteins called monoclonal antibodies, and a group called the gepants. Okay, first up, the ditans. What these do is they hit a very specific receptor on the nerve itself, basically telling it, hey, stop releasing all that CGRP. And the key advantage here, the real game changer, they do all this without causing that dangerous blood vessel constriction. That makes them a much safer option for a lot of people. Now, the second strategy is just fascinating. It uses something called monoclonal antibodies. Think of these as tiny, lab-engineered guided missiles. You inject them, they circulate in your body, and their one and only job is to find and neutralize CGRP. This makes them absolutely perfect for preventing migraines from ever starting in the first place. And that brings us to our third approach, the gepants. These are pills you can take, and they work by essentially blocking the docking station for CGRP. So even if your body releases CGRP, it's got nowhere to go. It can't plug in and cause all its havoc. This gives patients yet another powerful tool to stop an attack right in its tracks. So stopping an attack when it happens is one thing. But for people who suffer from frequent migraines, the real holy grail is prevention, what doctors call prophylaxis. The goal here is simple, to reduce how often and how severe the attacks are, hopefully before they even happen. For years, preventing migraines was this weird process of borrowing drugs from other medical fields. Doctors were trying everything. Antidepressants, drugs for epilepsy, even blood pressure medications. And honestly, it was all with pretty mixed results and a whole bunch of side effects. So you can see some of the traditional choices on this table, right? Things like beta blockers, where a drug called propranolol is often the first thing doctors try. But look at the bottom. That's the real game changer, this brand new class of CGRP antagonists. Finally, a prevention strategy that was designed from the ground up specifically for migraines. So what this whole migraine story really shows us is the incredible power of finding the true molecular culprit. By zeroing in on CGRP, we've basically traded in our sledgehammers for scalpels. We've gone from blunt instruments to precision tools. And this breakthrough, it just raises this massive, exciting question. What other complex neurological diseases, think about Alzheimer's or chronic pain, are just waiting for us to find their CGRP? The revolution in migraine care, it might just be the beginning.